Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Okay, take a deep breath because you are pregnant. But with the overwhelming joy comes a lot of anxiety once the doctor tells you that you have a high-risk pregnancy. What is it? How do you deal with it to ensure your health and the health of your baby? Joining us to talk about this is Dr. Shawn Daneshmand, an obstetrician and gynecologist who is the medical director of maternal and fetal medicine at Scripps Clinic, and Caitlin Grandfield, who is a prenatal genetic counselor. Thank you both for being with us.
Thank you for having us.
Thank you for having us, Susan.
So go into a little bit more detail. What is a high-risk pregnancy?
A high-risk pregnancy is a condition where both the mom or the fetus or both could have any pregnancy-related complications.
And what are the symptoms of a high-risk pregnancy?
So high-risk pregnancies can be divided into pre-existing conditions, any medical conditions such as high blood pressure or hypertension, endocrine disorders such as diabetes or thyroid abnormalities, any autoimmune disorders such as lupus or rheumatoid arthritis, or excessive, for example, weight or obesity. It could also be during the pregnancy, so pregnancy-related complications such as preeclampsia. This is a condition where blood pressures are elevated. It could also involve other organs such as the liver and the kidney. It could be premature labor or delivering less than 37 weeks of gestation. It could be diabetes in pregnancy, that's diagnosed in pregnancy. It could also be fetal conditions such as, for example, congenital abnormalities with the baby or fetal growth restriction where the baby is not growing very well. We could have placental abnormalities such as placenta previa or any blood vessels in front of the cervix called vasoprevia.
That's a lot of stuff. So how do you know that you have a high-risk pregnancy, perhaps before you even get pregnant?
That's a great question, Susan. The best thing to do prior to getting pregnant or planning on having a family is to meet with your OBGYN or meet with your family medicine, primary care physician, and basically discuss your medical history, your surgical history, your family history, any medications you may be on. That's the best time to kind of elicit if further consultations, for example, with a maternal fetal medicine physician is needed or recommended. This is the best way really to plan because, again, you want to optimize your health prior to getting pregnant because when you have any kind of chronic health issues, then there's an increased risk for comorbidities during pregnancy.
And then what kind of tests would you run for patients?
Well, remember, maternal fetal medicine physicians or high-risk pregnancies physicians do fetal imaging. So we're kind of fetal radiologists. We look at the baby with ultrasound during your pregnancy. We do a very detailed assessment of our baby in the early first trimester, anywhere between 11 to about 14 weeks, and then again around 20 weeks. So fetal imaging is a big part of what we do. We also have diagnostic procedures such as genetic testing, such as a chorionic villus sampling, or amniocentesis, where a needle is inserted into the uterine cavity and some fluid when the baby is drawn to test for chromosome abnormalities. There are also procedures depending on the patient's pregnancy history, for example, that we can do to make sure that the baby and the mom are both doing well and are carrying the pregnancy to term. There are also fetal procedures that we do, for example, in case of a fetal anemia, where the baby's blood count is low, called an intrauterine transfusion. There are also centers in the country that do fetal surgery, for example, in babies with multiple gestation or twins that are sharing one placenta and have a condition called twin-to-twin transfusion syndrome.
And Caitlin, what is a genetic counselor?
Genetic counselors are healthcare professionals who provide education and support to patients surrounding pregnancy.
And then what are you screening for?
So we screen for general genetic conditions such as Down syndrome, cystic fibrosis. We screen for congenital abnormalities or differences in the way that the baby is formed that could or could not be associated with a genetic condition, as well as screening for those at risk for a familial condition or have a family history of a genetic condition.
What would that be?
So familial conditions can be things like heart defects or cystic fibrosis. Some of these are multifactorial, where we know that there's their family history, could be an increased chance to have a child with that condition, versus people that have a genetic condition passed from parent to child. We can screen the pregnancy for those as well.
And so can women come in before they become pregnant to get this genetic counseling?
Yeah, genetic counseling is available pre-conception or during pregnancy. The testing options might be different depending on if you are pregnant or not, but we absolutely encourage pre-conception genetic counseling to discuss things like family history and carrier screening.
And let's say you find a genetic abnormality. What happens then?
Genetic counselors can help explain your results of either your genetic test result. Some results mean an increased risk, where other results mean a diagnosis. Genetic counselors can help explain your ultrasound findings to see what is going on in the pregnancy. We help facilitate additional testing that might include additional ultrasounds, MRI, or possibly prenatal diagnostic testing such as amniocentesis, and help make a plan for follow-up that is in line with the family's values.
And Dr. Daneshmand, what is in-hospital antepartum care?
Antepartum care is, for example, if a patient requires hospitalization prior to a term pregnancy, the time when we want to have a baby between 37 weeks and 42 weeks of gestation. These are conditions, for example, if we suspect the baby is very small and requires more further intensive testing or monitoring during the pregnancy. If a mom, for example, has premature labor, if a mom has placenta previa where she's having any symptoms such as bleeding. So it's just basically, sometimes we have to observe moms. It may be non-pregnancy related issues as well. If a mom has appendicitis, for example, during her pregnancy and requires surgery and needs to be admitted to the hospital. So we have an antepartum unit that basically monitors these moms during their hospitalization until they're safe enough to go home.
And explain what a fetal diagnostic procedure is.
Fetal diagnostic procedure typically refers to genetic testing. There are genetic screenings that we offer patients with the help of our genetic counselors. And there are fetal procedures that we do to ascertain the baby's chromosomes, for example. One is called the chorionic villus sampling that's performed in the first trimester. That could be done through the cervical canal, or it could be done transabdominally or through the abdomen. And one is called the amniocentesis that can be done at any time, but typically it's done anywhere between 16 weeks to about 21 weeks of gestation. And that is, again, when a needle goes through the abdomen inside the uterus and draws amniotic fluid to be tested for any kind of genetic conditions.
Caitlin, you want to add to the fetal diagnostic procedure?
Yeah, so fetal diagnostic procedures are two ways that we can collect a sample in order to do genetic testing. One is a biopsy of the placenta, so the shared organ between mom and baby. The second is a sample of the amniotic fluid that surrounds baby. Both of these procedures allow various types of genetic testing for our patients, depending on the indication.
So how do you manage a high-risk pregnancy that is complicated first by maternal diabetes? The mom has diabetes.
Maternal diabetes is, we have the Scripps Institute where we have a diabetes and pregnancy program where perinatologists or maternal fetal medicine physicians work alongside with endocrinologists to take care of mom's blood sugars. We have weekly reviews of the blood sugars, and we can adjust their diet and also if there's any requirement for any medication to improve their blood sugars.
And what about hypertension, high blood pressure?
High blood pressure depends on if this is a pre-existing condition, such as chronic hypertension, or if this is pregnancy-related, such as preeclampsia, where blood pressures rise during the pregnancy and can affect other organs. We monitor these patients very closely with frequent visits to the office or within the hospital, with also serial fetal scans, looking at the baby's growth and coming up with a delivery plan depending on the diagnosis.
And what about an autoimmune disorder?
Autoimmune disorders depends on, again, what the condition is and what kind of organs are involved, such as lupus. It could affect, for example, the kidneys. Patients can have hypertension, or it could be a rash, for example, that caused the diagnosis. So it really depends on the diagnosis, but we have a multidisciplinary approach to managing these patients as well with our rheumatologists, with our primary care physicians, et cetera.
And what if the mom is pregnant with more than one baby?
Yes, absolutely. So multiple gestations is something that we work along with our obstetricians, with our colleagues, with our neonatologists, because moms who carry twins or triplets have a high risk of delivering prematurely. So these moms get a lot more frequent prenatal visits, more frequent ultrasounds and consultations, because they are at risk for other complications such as preeclampsia or premature labor, diabetes, et cetera.
And what about an abnormality with the placenta? Explain what that is.
So in pregnancies, we always think about the mother, placenta, and baby. The placenta is a fascinating organ that does all the exchanges between mom and baby. So the oxygen, for example, is delivered to baby through the placenta. The placenta serves many functions. If it's, for example, small, it can lead to a baby that doesn't grow as well. If it's located in front of the cervix, it could pose an increased risk for bleeding during the pregnancy. If it's embedded within the muscle of the uterus, it can cause more complications. But the placenta is a fascinating organ that we're still continuing to learn a lot more about.
And Caitlin, let's say somebody is thinking about getting pregnant. What do you say to them in terms of what they should do to prepare to get pregnant?
Yeah, so I would say to talk to your OB provider about ways to stay healthy, and then ask to speak with a genetic counselor for preconception genetic counseling to talk about family risks and carrier screening.
And Dr. Daneshmand, if somebody says to you, yeah, I'm thinking about getting pregnant, what do you say to them to prepare?
I think that's a very important question. And I think that's the best time, like Caitlin mentioned, to speak to your OBGYN, to your primary care physician. Again, review your medical history, family history, surgical history, any medications you may be on, so you can get the best advice on how to prepare.
Any final thoughts?
Yeah, learning that you have a high-risk pregnancy can cause lots of anxiety. Here at Perinatology, our team of genetic counselors and physicians can really help explain your diagnosis and help you make a plan moving forward.
Doctor, any final thoughts?
I think we can all agree, Susan, that everyone wants to have a healthy child, a healthy pregnancy. So the most important period and really is prior to getting pregnant. Meet with your providers, talk to them about your medical history and your family history. And again, that way you can see any kind of specialists that are needed to make sure that you can ensure a very healthy pregnancy.
Thank you both so much for taking the time to be with us. We really appreciate it.
Thank you, Susan.
Thank you so much, Susan.
If you'd like more information on preparing for and managing a high-risk pregnancy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.